to school, at least mom and dad will. That means shopping for school supplies, getting geared up for the new semester. Something else you need to consider, getting back to good health. The Oklahoma City Clinic-Edmond is having a session later this week on back to school, back to good health. And Dr. Lauren Garibelli is a pediatrician with the Oklahoma City Clinic, and we appreciate you coming back.
Thank you.
Thanks for being here. You know, with school starting, some things we need to think about right now, health issues.
That's right. For all the parents out there, when was the last time you looked at your kid's shot record or had a checkup for your child? It's really a good time during the summer to get those things done.
And time is winding down. Let's say we have a pre-K starting or a kindergartner starting this year. What about those vaccines?
Well, in order to go to school, kids are required to have certain vaccines. I like to think about it as there are 4 shots at 4 years old. All kids need their tetanus booster, their final tetanus booster until they're 11 or 12. That's the DTaP. Diphtheria, tetanus, and pertussis.
Yes.
Their measles, mumps, rubella vaccine, their polio vaccine, and their chickenpox vaccine. The chickenpox is just a strong recommendation.
And then for middle school, it's a good time going into school to get a checkup, I would assume.
Absolutely. A lot of times parents don't realize that the middle school and high school kids will actually need their a form filled out for athletics. They need a sports physical. It's a good time for you to see your pediatrician in order to check your blood pressure, talk about health issues, and also get caught up on any vaccines you may be missing.
And then I know we're not going to leave college students out either, because there are health concerns for them as well going on to those campuses with all of those other students.
It's one last opportunity for you to make sure to get that checkup before you head off to school, and also to get a meningitis vaccine if you haven't already had one. Meningitis is spread among kids that are living in close quarters in the dormitories and that sort of setting, and it's really important for kids that are heading off to college to get that vaccine before they go.
I know you're going to have a session coming up, and we're going to share that information. What can we expect at this special session that you're having at the clinic to cover all of this information?
I'll be there, happy to answer any questions about what vaccines your child may need if you bring your child's vaccine record, or just any general questions about what happens when you go to a pediatrician's office.
That's great. So we can check our report card, so to speak, to see if we've got everything checked off. Doctor, thank you for being here again. The Oklahoma City Clinic's location, they have that 1-hour session we were talking about. For more information on it, head over to news9.com. It's July 30th at noon. Again, they'll talk about everything we've talked about today at 200 North Bryant in Edmond. Again, more information, news9.com/first at 4.